Welcome and thank you for joining us this evening for one of our most popular annual events, How to Choose the Right Medicare Option. My name is Sandy Adams, and I am a lead financial planner and partner here with the Center for Financial Planning. We're so pleased to have you with us again for our expert and professional partner in the Medicare area, Cynthia Brown from Powers Financial Benefits. Cynthia has been doing these sessions for us now for, I don't know, 4 or 5 years, I think. And we always learn something new and find that everyone who attends finds great value in these sessions. We know that Medicare is complicated. And if you don't review your plan each and every year, you can end up in the wrong plan for your situation. We aren't the experts here. Cindy is. And we keep your retirement income plan so your premiums stay reasonably low, so that you don't end up paying too much for Medicare. But we don't know about the rest, and that's where Cindy comes in, and she has some great updates for you this evening. If you find that after this session that you have questions for Cindy or your planner here at the center, or that you'd like to schedule a one-on-one session to find out about how much Medicare impacts your financial plan, please reach out to us here at the center, and we're happy to arrange to answer your questions or arrange for a one-on-one meeting. With that, I will hand things over to Cindy so she can give us all of the updated information on Medicare for the upcoming year. Cindy, take it away.
All right. Well, thank you, Sandy, for the opportunity to speak on this most relevant topic. And thank you all for attending this evening's webinar on navigating the Medicare maze. There are some changes for 2023 in how the initial enrollment period to Medicare will work, as well as changes in prescription drug coverage that will be phased in over the next 3 years. These are all positive changes, and I'm excited to be able to share them with you, along with discussing the basics of Medicare and answering some questions that I am frequently asked from those that are approaching this Medicare space. I do advise that as you approach the Medicare space, that you either become an expert in all things Medicare, or what's most preferable, in my opinion, is that you work with someone who already is an expert in Medicare and deals with it day in and day out, all day, every day. So with that, let's get started. And we're going to move the slide here to what is Medicare? Medicare is a U.S. government national health insurance program that began in 1965 under the Social Security Administration and now is administered by the Centers for Medicaid and Medicare Service. And this is to provide people at this age with health insurance. Prior to that, there were not good options. It also provides health insurance for Americans that are under 65, but that are determined disabled by the Social Security Administration, and that can include people with end-stage renal disease and ALS. And besides needing to be at least 65 and older to qualify, or to be under 65 with certain disabilities, you must also be a U.S. citizen or legal resident of at least 5 continuous years and be entitled to receive Social Security benefits. Let's talk about the parts of Medicare. There are lots. Medicare is alphabet soup, and we're going to dive into some of these letters tonight. But the basic Medicare, or otherwise known as original Medicare, consists of 2 parts, and that is Part A and Part B. Those are the only pieces of Medicare that you get from the government. Anything else that you add to your Medicare is obtained through private carriers. As far as what's covered under Part A, think of that like facility coverage. So that is for those that are admitted to the hospital on an inpatient basis, taking up that room and bed and getting that nursing care, as well as those that following a qualifying hospitalization need to have some skilled rehab, but it does not cover long-term custodial care. So I want to make sure that we differentiate between skilled rehab that's meant to get you home, which is covered by Medicare, versus that long-term care stay. Part A also includes coverage for hospice and some part-time home health care services. Part B of Medicare, literally there are chapters of services that are covered under Part B. But think of it as your coverage for your medically necessary medical services. And I'm just listing a few of them here, but Part B covers things like outpatient surgeries, outpatient chemo and radiation, outpatient testing, like maybe MRIs or CAT scans, x-rays, more day-to-day things like doctor's visits and preventive care, as well as durable medical equipment, a ride in the ambulance, and certain drugs administered in healthcare settings. So again, this is just a small list of the coverages under Part B. It is very comprehensive. So what do you pay for Medicare? Well, most people do not pay anything for Part A of Medicare as long as they've had at least 40 calendar quarters of work in which they paid Social Security taxes in the United States. That breaks down to about 10 years over your lifetime, of employment. Also, Part A is premium free if you're eligible for railroad retirement benefits or if you have a spouse that qualifies for premium free Part A. I put premium free in quotes because I don't think of it as necessarily free as you paid for it during your lifetime and your payroll taxes, but there is no additional cost once you go on Medicare. Now, so that's like I said, about most people won't pay anything for Part A. If they meet those criteria, there's very few people that would have to pay for Part A, but there are out of pockets under Part A of Medicare. So if you are inpatient in the hospital and you're there from 1 to 60 days, there is a $1,600 deductible. Now, that is not an annual deductible like what we're typically used to. The way a benefit period works with Medicare is it starts the day you're admitted to the hospital and it ends once you've been outpatient for 60 days. So if you had to go back to the hospital after that 60-day break in care, you would start over with another, for next year, it's a $1,600 deductible. Medicare tends to increase these amounts each year. For days, if someone's there from 61 to 90 days, they would then have to start chipping in $400 a day for each of those days. And then from days 91 to 150, that copay doubles and goes up to $800 a day. And there are a couple things that happen if you hit a 90-day stay in the hospital and you move to that 91st day. As I mentioned, the copay doubles, so that's one thing. But you are also now using what's called lifetime reserve days, of which Medicare gives you 60. For example, if someone has a 100-day hospital stay, 10 of those days, those last 10 days, are going to be pulled from the lifetime reserve days, which would leave that person with 50 lifetime reserve days that they could use over the remainder of their life for any stays exceeding 90 days. Keep in mind, anytime you're out of the hospital for 60 days, those 90 days of benefits are going to refresh. Supplements also add an additional 365 lifetime reserve days on top of Medicare's 60. So it'd be very hard to exhaust all those days because they typically are not keeping you in the hospital for that long. Another important part of coverage under Medicare A is that skilled rehab. So you have to meet the criteria for it to be covered. The biggest one being you have to have been inpatient in the hospital for at least 3 days, so 3 overnights. And if you medically need to have that skilled rehab, Medicare will then pay for the first 20 days. You still are covered potentially up to 100 days, but from days 21 through 100, you would have a $200 a day copay. If you get to 101st day, at that point, you have to pay all the remainder of the costs for that rehabilitative stay. Medicare only covers up to 100. Now, that is a renewing benefit. So if you are out of that skilled rehab for 60 days and down the road, you have another qualifying hospitalization, you will then have potentially up to another 100 days. I should mention too that with hospice and the part-time home health care that are also covered under Part A, there is no cost sharing for those. Well, let's look at the cost of Part B because there is a premium for that. And good news here is that they actually reduced those premiums for 2023. So in a year where everything seems to be going up, it's nice to see that maybe, a few things are going down. And while it's not a big reduction in premium, I'm just really happy that it didn't go up. But not only did Medicare reduce the Part B premiums for next year, but they also increased the income threshold. So let me break that down a little bit. But basically, if you were enrolling in Medicare for 2023, the government is going to look back at your 2021 tax return, and they're looking at your modified adjusted gross income. So as a single tax filer, if you are, and if in 2021 you were 97,000 or less, you would pay the standard Part B premium of $164.90 a month. For a joint tax filer, that threshold is $194,000 or less. So most beneficiaries are in that standard premium bracket, but there are some that have to pay more for their Part B based on income, and that is called an income related monthly adjustment amount. It's otherwise known as IRMA. So you can see that for some people that Part B premium can get quite high, and at the top end, it's at $560.50 a month. But you have to be over 500,000 as a single tax filer or 750,000 as a joint tax filer. Now, often this is what happens. Somebody will come to me and they've worked, and they're now going to retire and they're eligible for Medicare. And maybe they were in one of these higher income categories because they were still working, but upon retirement are now going to be in a lower income category. If you don't raise the flag and fill out a form, it's called an SSA 44, you're just going to pay that higher premium amount until 2 years later when Medicare reassesses your income, because they're always looking 2 years back each November, and they reestablish your Part B premium for the next year. So again, if you don't file something called an SSA 44, you're just going to pay that higher premium until they finally see that your income was reduced. So there is something, and I've mentioned it 3 times now, the SSA 44 that can be filed if you are retiring and your income is going to be reduced because of that retirement, putting you into a lower bracket. I help clients with these, make sure they get filled out properly. I'm going to show you what it looks like after I've mentioned that there are a few reasons that you can file this form. So there are 5 of them. The most common one is the one in the middle in the teal blue, that you or your spouse stopped working or had a reduction in the number of hours you work. But also it can be filed if your income is changing due to the death of a spouse, a marriage, or divorce. If you had an involuntary loss of an income producing property due to a natural disaster, disease, fraud, or other circumstances. If you had a loss of pension or receipt of settlement payment from a current or former employer due to the employer's closure or bankruptcy. So by and large, the most common reason people are filing the SSA 44 is that they or their spouse have had a work stoppage or reduction in hours. And the way that form looks, and this form is revised every year, is right here on the screen. But the first page is very simple. You just put in your name and social security number. The second page is in step 1, where you check the type of reason for your type of life-changing event. So in the example I just mentioned, where I have a fellow that's, and maybe I didn't mention the example, but I'm working with someone who's retiring at the end of this year. So he's going to check work stoppage. His income has been high the last few years and this year. And then he's going to put in his date of life-changing event, in his case, 12/31/2022. And then in step 2, he's going to put tax year 2023 and what he projects his adjusted gross income and any tax exempt interest will be. And then he checks his tax filing status. In his case, it's going to be married filing jointly. In step 3, you can put it the next year. So for him, 2024, if you believe that income is going to be even lower, you can fill that in the next step. And then on the last page, you just sign it, put in your phone number and your mailing address. We fax these into Social Security for our clients to their particular local office. And I will say it typically takes 4 to 6 weeks for these to be processed. I've seen them as short as 2 weeks, sometimes as long as a couple of months. But once they're approved, they do go back and credit you for any adjustment in that IRMA based on that event to when your Part B started. So they're very good about that. But that's a very important tool to be aware of, because if that's your situation and your income is going to be lower, you want to make sure you file that and get that reduction. Otherwise, you're waiting 2 years for them to finally see that your income's gone down, and they don't go backwards and give you any money back. They just, for the next year, adjust your bracket. I also want to mention, I should go back to that slide for 1 second, that if you file this SSA 44 and you put in what you expect your income will be, and then let's say you greatly exceed that because you had a capital gain or some other type of transaction that resulted in higher income. So if you exceed the bracket that you stated, they will eventually catch that 2 years down the road, and they will charge you the difference between what you should have paid and that adjusted amount. They don't charge any penalties or interest, so that's the good news there. But let's talk about Medicare Part B out of pockets now. Now that we've addressed the premium that you have to pay to have the coverage, there are also some out of pockets under the coverage. So, more good news for 2023, the Part B deductible is being reduced. It's currently $233. Or next year, it will be $226. So, a slight reduction, but again, I'm just glad to see it didn't go up. So under Medicare Part B, you would have to satisfy that deductible before Medicare starts paying for your medical services. And once that happens, Medicare then pays 80% and you have a 20% coinsurance. The problem with that is there is no cap on the 20% coinsurance. And that's why I've got all those dollars, printed under that 20% coinsurance, because if you had to pay 20% of a surgery or chemotherapy or durable medical equipment, any number of things, it could result in a very large out of pocket for you. And we'll talk about in a few minutes what you can do to limit your out of pocket. So let's say you're going to be turning 65. This is really decision time for you. Common questions that I receive when someone's approaching their 65th birthday are, I'm still working or my spouse is still working and I'm covered by a group health plan. Do I need to enroll in Medicare? Another question is, well, I'm retired. I have retiree coverage. So do I need to enroll in Medicare? So it's a couple very common questions. Let's look at the answers. So if you are still working or your spouse is still working and you're covered by an employer group health plan that has 20 or more employees on the payroll, then you can delay Medicare without penalty. You can enroll at any time while you're still working and up to 8 months after that employment and coverage ends without penalty. However, if the employer has less than 20 employees on the payroll, Medicare will be primary to that group health plan. And so you need to enroll in Medicare's both parts A and B. If you don't and you have claims, the carrier can deny and reject those claims because they will want to see that Medicare paid their portion first. So it's almost as if you don't have coverage. So always, always, always check with your HR department to see if you need to enroll in Medicare. Again, if the group health plan is primary, you don't. If the group health plan is secondary, you do. And people often will call me and ask me that question, and you're welcome to call me as well. Now, if you have retiree coverage, you almost always need to enroll in Medicare Part A and B with very few exceptions. Check with your former employer, but it's highly likely you are going to need both Medicare A and B because Medicare is almost always primary to retiree coverage. So be careful with that one. Then the next set of questions that I get from someone who has that employer with over 20 employees and the group health plan is primary are, should I just enroll in Medicare Part A? Since there's no premium for Part A for me, should I just go ahead and get it? Another question is, well, what about a prescription drug plan? Do I need to enroll in Part D? I hear there's late enrollment penalties if I don't do that at the right time. Then another question that I will get from someone is if their contribution to their group health plan is significant or they're not like satisfied with the group health plan coverage, they'll ask, can I leave my employer plan in favor of Medicare? So let's look at those answers. Should I enroll in just Part A? Well, there are two very important reasons why you should not enroll in Part A. And one of them is if you are working for an employer and they have prescription drug coverage in their plan that is not creditable, then please delay Part A of Medicare, because once you enroll in Medicare Part A, you will set off a time clock on your Part D, and it could involve a late enrollment penalty if that group health plan is not creditable. I will say it's far more often than not that the group health plan is creditable, but there are some that aren't. And we see that when the group health plan is a high deductible HSA plan with a deductible that exceeds $3,000 per person. But you can always check with your employer, find out if your drug coverage is creditable. The second big reason not to enroll in Part A is if you have an HSA qualified plan and you want to continue contributing to that HSA savings account. Once you enroll in any part of Medicare, you're no longer eligible to contribute to the HSA. And we'll look at that in a little more detail a little later on in the presentation. So then the question is, well, okay, should I just enroll in a Part D prescription drug plan? Well, yes, if your group health plan, I would say most of the time no, but yes, if your group health plan prescription coverage is not considered credible and you enroll in Part A of Medicare, because then you will have triggered that time clock. Again, most of the time, the group health plan is creditable and you can delay Part D without penalty, but something to definitely be aware of and to check into. And then the last question, can I leave my group health plan in favor of Medicare? Well, generally speaking, yes. I've seen it where some employers require proof of your Medicare coverage, but you want to keep in mind if you leave that employer plan, if you have dependents on your plan that aren't eligible for Medicare, they're going to lose their coverage. So sometimes you want to continue with that group health plan to keep your spouse and dependents covered. Here's some considerations that you may want to make if Medicare is primary to your group health plan. So again, that would be if your employer has less than 20 employees on the payroll. Remember that in that case, you have to enroll in Medicare A and B and you have to pay for Part B. So something to look at in that case is, since you have to pay for Part B anyways, does it make more sense to leave the group health plan and go on an individual supplement or an Advantage plan? So you have to look at, what is your cost to be on that group health plan? What are the benefits? Does it exceed the cost of individual supplementation? So sometimes we find out it's actually more expensive for somebody to stay on that group health plan than to leave it and get their own supplement. But you also, again, you have to consider if you have other family members on the group health plan. If you leave, they're going to lose their coverage as well. Here's another thing I just want to mention, that let's say you're in the situation, your employer has less than 20 and you have to enroll in A and B. Once you enroll in Part B, that does trigger a 6-month time clock to get any Medicare supplement without medical underwriting. So you'll still have a 60-day window once your group health coverage ends and that active employment ends to pick up a supplement under guaranteed issue rights, but carriers don't have to offer all their plans as guaranteed issue plans. You'll still have a good selection, but it is just something to consider. All right, so when can you enroll in Medicare? There are 3 different enrollment periods with Medicare. The first one that people approach is their initial enrollment period, and that coincides with their 65th birthday. The second one is a special enrollment period, and that is for people who were able to delay Medicare because of that employer coverage being primary. They will use a special enrollment period when the time comes. The last option is the general enrollment period, which is every year from from January 1st to March 31st. So let's break each one of those down. We're going to start with the initial enrollment period. There are changes in the initial enrollment period for 2023. So I'm going to start with 2022 because there may be some of you that have a birthday yet this year and are going to fall under this timeline. But basically, that initial enrollment period is the 7 months surrounding your 65th birthday. And it's the 3 months before, the month of, and the 3 months after. So you're going to want to use this initial enrollment period if you don't have group health plan coverage. And I do want to mention that when you are born on the 1st of the month, your initial enrollment period starts 1 month sooner. So typically the 4th month of the initial enrollment period would be somebody's 65th birth month, but that is not the case if you were born on the 1st of the month. Everything would start 1 month sooner. So when you enroll during your initial enrollment period determines your Medicare effective date. So if you sign up during the 3 months before your 65th birth month, and again, keep in mind it's different if you're born on the 1st. I'm sorry, I know I'm repeating myself on that. But if you sign up those first 3 months, then your coverage is going to be effective the first day of the 4th month, which is usually your birth month. If you wait till your birth month, you're going to have a 1 month delay in your Medicare coverage. It'll start the month after. If you wait till the 5th month of your open enrollment period, they delay your coverage for 2 months. And if you enroll in either the 6th or 7th month, your coverage is delayed by 3 months. I help break that down for people based on their individual situation. but they're simplifying this for 2023. So whenever they simplify things, that makes me happy. So how it's going to work for people turning 65 next year is the first 3 months are going to be exactly the same as what it is now. If you enroll in the first 3 months of your IEP, your effective date is going to be the first of the fourth month. However, on that second, in that last window, your birth month or the fourth month and the 3 months after, now starting next year, if you enroll during those months, your coverage is effective the first of the month following your enrollment. So no more 2 to 3 month delay. So I think that's a much better system. Let's talk about how to enroll in Medicare during your initial enrollment period if you need to do that. So there are basically 3 options. One of them is online at ssa.gov/benefits/Medicare. You need to have at some point in your life created an ssa.gov account to use this method. We help our clients with this just to make sure they don't get tripped up. That's a very good option because it seems to get your Medicare application done very quickly. You can also call your local Social Security office and make an appointment for a phone enrollment, but appointments can be pushed several weeks to, a month out. Last option is now that Social Security offices have reopened to the public, you can actually just go to your local Social Security office and enroll in person. That can be a long wait while you're there, but that certainly is an option. I also want to mention if you are collecting Social Security at least 4 months before your 65th birthday, you're going to automatically receive a Medicare card in the mail, and you're going to be enrolled in both parts A and B of Medicare. If you're not collecting Social Security, however, then you do need to actively enroll using one of the 3 options that I just mentioned. So let's say that you delayed Medicare and you're now outside your initial enrollment period because you continued to work and had coverage based or your spouse continued to work. So based on that active employment, you were able to delay your Medicare. You'll now use what's called a special enrollment period when you retire. So I would just want to mention too that somebody's retirement or sometimes someone's retirement will intersect with their initial enrollment period. If that's the case, the initial enrollment period always trumps the special enrollment period. So that's another thing I help people navigate as it does tend to come up from fairly often actually. When you're enrolling under a special enrollment period, there's a couple forms you're going to need. And I've got the 2 of them, just a picture of them up here on the slide. If you did not enroll in Medicare Part A, let's say you delayed that along with B, you'll actually only need the second form, the request for employment information. And that is a form that's completed by your employer. And the reason you only need that form is because your record actually is going to need to be built with Social Security. So we help people do that online, but another option is to just, go to the local Social Security office and they'll build your record in person. Then you give them this request for employment information or we fax this to them and they process it and get you that Medicare effective date that you need. You can push out that Medicare effective date up to 3 months. So you don't necessarily want to wait till when you retire. You want to start the process a few months before. If you've already got Part A of Medicare, when you go to do this, you need both of these forms. And that first one is an application for enrollment in Medicare Part B, and you give them your Medicare number. You check the second box, yes, that you want to enroll in Part B, and fill out the rest of the form. An important part of that form is number 12, which is the remarks. You always want to state when you want your Part B to begin. And note, Part B of Medicare or any other part of Medicare is only going to start on the first of the month. So if you're retiring December 15th and your coverage is ending December 15th, you're actually going to want to start your Part B for December 1st. Even if you were to let COBRA for half a month, COBRA is secondary to Medicare. So just remember that it's always the first of the month. We help our clients with these forms. There's a way that we can actually submit that Part B application online. If you already have Part A, it's a pretty simple process. So again, I always recommend you just work with someone who's well steeped in this territory and can help you get enrolled the right way at the right time. So the last type of enrollment period is that general enrollment period, and this is for people that missed their initial enrollment period, or if applicable, they missed their special enrollment period. They will then have an opportunity January 1st to March 31st each and every year to enroll in Medicare. And this is new for 2023. If you use that general enrollment period, your coverage is going to begin the month following your enrollment. It used to be that they pushed it off till July that year. So again, this is another, I feel, good improvement. This is not an enrollment period you necessarily want to use though, because it usually means if you're using this, you're going to be faced with a late enrollment penalty for Part B. And that penalty is 10% for every 12-month period that you went without Medicare Part B coverage, and it stays with you for life. So now that we've talked about the parts of Medicare, the cost of Medicare, how to get enrolled in it, if you recall, on one of the slides I mentioned, well, on a few slides, the out-of-pockets under Part A, the hospital deductibles, daily copays, as well as that Part B uncapped 20% coinsurance. There are two different coverage pathways that you can take to put a stop on your exposure under Medicare. They're very different coverage pathways. One of them is called a Medicare supplement, which is also known as Medigap. And I tend to use both terms, but they mean the same thing. A Medicare supplement works in tandem with your Medicare. So you keep your Medicare coverage, and that supplement's going to fill in the gaps. To what extent depends on what supplement you get. The other type of coverage is called a Medicare Advantage plan, and it is an alternative to Medicare. So it will replace your original Medicare coverage. You will still have that Part B premium, so that does not go away. But I want to give you an overview of the differences in these coverages. And please keep in mind that really this is a very good one-on-one conversation to have when you are approaching the space as to what's going to be the better option for you, because everybody has, a different financial situation, different help, although you can't always predict your help. And also, maybe you have a home in another state besides Michigan, so that might make a difference in the type of coverage that you pick. So I'm just doing some broad brushstrokes tonight, and it's really something better that's discussed one on one. But let's talk about the supplement first. So typically, supplement versus an advantage plan, you're typically going to have a higher monthly premium, but also typically much lower out of pocket for medical services. With a Medicare supplement, you have the freedom to see any doctor or facility in the US that accepts Medicare. So that's really important to people that maybe they want the option to be able to go to Mayo Clinic or Cleveland Clinic or John Hopkins, and many other places. So if you're under original Medicare with a supplement, you've got the best access to doctors and facilities. On a supplement, you're not going to need referrals to see specialists. Prior authorizations for services are very rare. Medigap supplements do not include dental, routine vision, or any type of routine hearing or hearing aid discounts. I will say that a lot of Medicare supplement carriers have started adding buy-up options for these. It's something that's been discussed that, people would like this to be covered under original Medicare. We haven't gotten there yet, but the conversation is definitely out there. So we'll see what happens in the future. Supplements also do not cover any prescription drugs. So if you are going with a Medicare supplement, you typically are going to want to purchase a separate Part D plan to cover your prescriptions. And I'm just going to throw in here that sometimes people will say, well, I don't take any prescriptions. Do I really need a Part D plan? Well, it's definitely not mandatory to enroll in Part D. But if you delay Part D and later in life then decide that you want it or need it, you have to wait till the open enrollment period in the fall to enroll. Your coverage won't be effective till January 1st, and there will be a late enrollment penalty, which is 1% for every month that you delayed enrollment into Part D and did not have other creditable coverage. So, for example, if somebody waits 5 years, that they would then have a 60% penalty on their Part D plan. And that's not based on their plan's premium. It's based on the national average Part D premium, and it stays with you for life. So most of the time people will maybe pick up in that situation where they're not taking anything, the least expensive Part D plan as more of a placeholder to, avoid a penalty down the road. This is probably one of the most important things that I would want you to remember from this presentation, that with the Medicare supplement, if you are applying more than 6 months from your Part B effective date or turning 65, whichever is later, you will be subject to medical underwriting and you can be declined or rated higher. So sometimes people think that each fall during that open enrollment period They can make whatever changes to their Medicare they want. And maybe they've been on a Medicare Advantage plan for a few years and want to switch to a supplement. That change is not automatic because the supplement carrier can decline them or rate them higher. So, very important piece of information there. I always recommend people pick their Medicare like they pick a marriage. Pick what you think you're going to be happy with for the long run, whether you're sick or you're healthy. Now let's talk a little bit about Medicare Advantage plans. So they are, as I said, an alternative to Medicare. They replace original Medicare, and now a private carrier will administer your claims. I'm going to go back to the supplement for a minute because the way the claims are administered under the supplement is through Medicare. So Medicare pays their share. They send the balance to your supplement carrier, no matter who that supplement carrier is. And then the supplement carrier has to pay their share. So they don't get to say maybe or no, they have to follow Medicare. And if Medicare paid their share, the supplement has to pick up theirs as well. With the Advantage plan, again, that's going to be administered by the private carrier. The claims are going to go directly to that private carrier. They generally have lower premiums than the supplement. Not always, but generally people are going for the Medicare Advantage plans that do have the lower premiums. But, potentially you're looking at more out of pocket. They are a network type of plan. So there are PPO, POSs, HMOs, but each Medicare Advantage plan is going to have a network of doctors that you're going to want to stay within to have the lowest amount out of pocket on your side. Advantage plans may require referrals to see specialists. And in many cases, you may need to get approval from your plan before it will cover certain drugs or services. So again, it's more managed care. Advantage plans tend to include some dental, maybe some preventive dental, and maybe a vision and hearing aid allowance. So people tend to, be attracted to those types of coverages. I do recommend not picking your Medicare for the extras because the extras are limited. And if you get some, dread disease, medical condition, you're probably not going to be real concerned about what the dental benefit is. So just keep that in mind. Medicare Advantage plans almost always include the prescription drug coverage. So you're basically wrapping your coverage all into one. Your Medicare is replaced by the Advantage plan, and that's going to include your medical services, plus almost always your prescription drug plans, or your prescription drug coverage. There are some Medicare Advantage plans that do not include prescription drug coverage. So got to take a look at that if you're going that route. There is an annual enrollment period every year from October 15th to December 7th, where one can enroll in an Advantage plan or they can switch to a different Advantage plan. No medical underwriting, no questions asked. Also, speaking of that annual enrollment period, that's also a time where people that are on a prescription drug plan can change to a different prescription drug plan. It will be for a January 1st effective date. And we do review our clients' prescription drug plans every year because things change. Their utilization can change and what they're taking. The carriers, may have years where they have high increases and another carrier might be better. So that's something we like to do an annual checkup on. There's just some broad brush strokes of the differences between supplement and Advantage plans. And again, it's probably a very good discussion to have one-on-one to determine what might be best in your situation. So I want to talk a little bit more on the Medigap plans, specific ones. There are 10 standardized Medigap plans. And for tonight, I'm just going to go over plans G and N. They are the most popular. But when I'm doing a one-on-one, we do cover all the, optional Medigap plans. Contrary to this with Medicare Advantage plans, I can't show you a nice, neat chart because every plan is different from the next. And those copays on the Advantage plans can change every year, and they usually do. So I don't have a nice, neat chart for that. But on the Medigap plans, since they're standardized by the government, carriers cannot deviate from the benefits. And basically what this chart shows is all of the out-of-pockets I talked about under Medicare Part A and B. And if it has a check mark, it means that supplement option or that Medigap plan picks up 100% of those out-of-pockets. So all the way down, you can see Plan G until you get to the Part B deductible, picks up the Medicare A and B out-of-pockets. So on a Medigap Plan G, your only responsibility for Medicare covered services is going to be that Part B deductible, which for next year is $226. That is the most popular Medigap option for many years now. Second to that is a Plan N. So with a Plan N, the differences are after that Part B deductible is satisfied, you then, and this is the footnote at the bottom, would pay up to $20 for an office visit and up to $50 for an emergency room visit. And the reason it's up to is you're basically paying 20% of Medicare's approved amount, not to exceed $20 for office visits or $50 for emergency room visits. The other difference, though, between an N and a G is something called a Part B excess charge, which we have not yet talked about. What that is there are some Medicare providers, it could be doctors, it could be durable medical equipment, but basically anything under Part B, where while they take Medicare, they don't have to accept Medicare's approved amount. And you know how Medicare and other insurance companies are always reducing. Set amount may be billed, but then they approve a lower amount. Typically, you see that difference written off. Well, if you're on Plan G and you go to a provider that doesn't accept the approved amount, the government actually will let them charge 15% above that. On a Plan G, the supplement would pick up that 15% excess charge. On a Plan N, the supplement does not pick it up. So you would be faced with that on your own. I will say the premium difference between G and an N is not very much. For tonight, I don't get into the various carriers that offer these plans. There are a lot of carriers that offer supplements. That is a more one-on-one discussion, but it is very important if you go with a Medigap plan, let's say you've picked that as your kind of coverage, that you also pick the right Medigap carrier. And I can go into the rationale for that, when I'm talking with somebody one-on-one and the things that you definitely want to consider. Okay, so I think we've covered that slide. I now want to talk about Part D prescription drug coverage. Again, if you're going with a Medicare supplement, you're typically going to want to pick up a Part D prescription drug plan. An exception to that may be if you have VA prescription drug coverage. You then don't need to pick up Part D if you don't want to. And if you decide later on you want to, VA coverage is considered creditable and you could, do it later in life. But the way Part D coverage works, it's complicated because there's several stages in the coverage. For 2023, the annual deductible under Part D, which is the first stage, is no more than $505. So you'll see that most Part D plans are going to have that $505 deductible, but also most of the plans waive that deductible on Tier 1 and Tier 2 drugs. The second stage of coverage is called the initial coverage stage. So that would occur, let's say you have drugs that are subject to that deductible. That would occur once that deductible is met and what you've paid in copays and what the insurance company has paid on your behalf hit $4,660. So during that stage, you're typically just paying, set dollar copays or a percentage coinsurance of the drug. Most people do not hit $4,660 in drug costs. But the ones that do then enter what's called the coverage gap. In the coverage gap, you pay 25% of the cost of all your scripts until you're out of pocket for the year, plus the brand name discount in the coverage gap, which is 70%, together hit $7,400. And again, I'm talking about the standard Part D model. So some carriers are a little richer than what I'm showing you here, but I'm just showing you the standard model. But if together, what you pay out of pocket and the brand name discount and the coverage gap hits $7,400, then you go to what's called the catastrophic stage of coverage. And at that point, you pay the greater of 5% of the cost of your drugs, or $4.15 for generics and $10.35 for brand names. So there are some positive changes to Part D that they're going to be rolled out over the next several years. So what's happening in 2023, and this is pretty huge, is if you are on insulin and it's covered insulin under your plan, the copay is going to be capped at $35 throughout the year. Shingles vaccines will be covered starting in 2023 with a zero cost sharing. So that's pretty big too, because, a call that we'll get fairly regularly is someone who's getting those Shingrix shots and they find out that they're going to pay maybe $170 to $200 per shot. And the reason being is while they are covered under Part D, they're typically subject to that Part D plan's deductible. And so the vast majority of people aren't hitting their Part D deductible. So when they go to get the Shingrix vaccine, they now have to pay it out, for the copays for the vaccine. So this is going to make a lot of people happy. If you are going on Medicare next year, or even if you're on it now and you haven't had your Shingrix vaccines and you want to get them, I would suggest not doing it anytime during the rest of this year, but perhaps waiting until January of next year. In 2024, Medicare is eliminating the cost sharing in the catastrophic level of coverage. That's that second to last stage. So basically, if you hit that $7,400 between what you pay and the brand name discount and the coverage gap of 70%, you then stop. No more copays. So you don't go on to pay 5% or those small copays that I mentioned on the previous slide. So that's nice, but it gets even better in 2025 because in 2025, they are capping the out-of-pockets on covered prescription drugs at $2,000. So, my average client does not get up to $2,000 in prescription drug costs, but I do have some that do that are on some expensive scripts, and maybe their costs throughout the year might be $7,000. So this out-of-pocket cap of $2,000 is going to greatly help, a certain percentage of people. So we're excited about that. So the cost of Part D plans have premiums. There's a wide range in premiums. So that's one cost is you have to pay your plan premium. And that's something we discuss on an individual basis, what that premium looks like. And again, it's going to be based on what prescriptions you take and maybe your preferred pharmacy. But I want to mention that some people pay more for Part D. So if you have an income related monthly adjustment amount on your Part B of Medicare, you're also going to pay extra for your prescription drug coverage. So sometimes people will look at this chart and they'll think, okay, I'm a single tax filer and I'm between 97,000 and 123,000. I'm going to pay $12.20 for my Part D. But that's not correct. That's just the income related adjustment. So they would have that $12.20 on top of whatever their Part D plan premium is. If you are eligible to have that Part B IRMA removed based on changing income and a life-changing event, they will also, remove or reduce the Part D IRMA, accordingly. I believe I already talked about the Medicare Part D late enrollment penalty, but basically I'm going to repeat it, and it's 1% per month for each month that you were eligible for Medicare Part D, but did not enroll and did not have other creditable coverage. That's their incentive to get you to enroll when you're first eligible. So I want to take a few minutes and talk about health savings accounts and Medicare, how they intersect and things to be aware of. Because more and more people are on health savings account these days. They're, a great way to set aside pre-tax dollars to be used for qualifying medical expenses. So let's say you get to Medicare and you have a nice amount of money or any money left in that HSA. It can be used to pay for Part A. Most people don't have Part A premiums, but if you did, it can also be used for Part B and Part D and Medicare Advantage plan premiums. So those can all be paid with pre-tax dollars. I do want to mention, because I've seen this happen, sometimes people that are using their HSA to pay for their Part B premiums, they'll try to send in that premium bill that Medicare sends you prior to when you're collecting Social Security. You're actually just billed in the mail for Medicare. But they'll take that coupon and they'll write in their HSA debit card number and send that in as the payment. For whatever reason, Medicare doesn't accept debit cards. So, you can just simply pay the premium and then reimburse yourself out of your HSA account. One important note is if you are the HSA account holder and you're not 65 or older, Medicare premiums for coverage for your spouse who is 65 and on Medicare are not qualified medical expenses. So you would have to actually wait till you become eligible for Medicare to use those HSA dollars on your spouse. So here's, it can be a little tricky, the intersection of HSA contributions and Medicare, like all things else Medicare. But as I mentioned in a previous slide, once you enroll in Medicare, you're no longer eligible to contribute funds to your HSA. So funds need to be prorated for the year in which Medicare is effective. So just as an example, let's say you enroll in Medicare and your Part A coverage begins June 1st. For that year, you can contribute 5/12, so for January through May, of that year's maximum contribution. You still have until April 15th of the following year to make that contribution. So the deadline doesn't change, just the amount that you can contribute. If there are excess contributions in that account that were made above that, threshold or the amount that you were actually qualified for, there is a 6% excess penalty. And also keep in mind that when you enroll in Medicare after turning 65, Part A is backdated 6 months. So that can complicate things further. I hope that someday they will change that, but for now, that is the way it works. And I'm often asked in the whole Medicare discussion, what about dental and vision coverage? So as I mentioned, original Medicare does not include dental or routine vision benefits. Original Medicare does cover, like if you have diagnoses of the eyes, like cataracts or glaucoma or macular degeneration, things like that, your vision exams will be covered by Medicare. They're not going to cover hardware like glasses or lenses. But there is no dental coverage under original Medicare at all. A lot of Medigap carriers, I think I mentioned this previously, are now starting to offer optional dental vision hearing buy-up packages. There are also individual dental plans and vision plans available to purchase in the marketplace. But keep in mind, these are limited benefits always. So again, I don't recommend you make your Medicare choices based on any particular dental or vision benefit. Now, Medicare Advantage plans typically include some dental, vision, and hearing aid coverage. Usually with hearing aids, it's just like a discount. It's not like you're going to get a free set of hearing aids. And then sometimes they actually offer like buy-up options that provide more robust coverage than what comes with the plan. So, and every Medicare Advantage plan is widely different in what they offer. I think that wraps it up for tonight. I was trying to get it in within an hour, so I think I actually have about 6 minutes to spare. But I want to thank you for joining this webinar, for listening in. And if you have questions or you need clarifications or you would like assistance with your own personal situation, please feel free to reach out to me. I've got my phone number and my email address listed here. I would be happy to help. There is no charge for calling me and asking me questions. So thank you again. I hope you have an enjoyable rest of your evening and a happy open enrollment.
Thank you so much, Cindy, for the great information. I don't know about any of you, but I am, there's so much new information that I'm completely overwhelmed. And I know that when I have questions about Medicare, I certainly reach out to Cindy because this is not my area of expertise. I was particularly excited to hear, Cindy, about the new Medicare premiums because it sounds like those clients of ours who are receiving Social Security will actually get to keep their upcoming cost of living raise this year for themselves.
Yay.
And they can spend it on something else. Yay.
Yes. Yay.
Thanks. And thanks to all of you for attending. I hope you learned something new that you didn't know before. And again, if any of you do have questions, either for Cindy or for us, any of your planners, please do reach out to us, either Cindy directly or to us, and we'll make sure that your questions get answered. And if you are interested in meeting with us, whether it's about how Medicare impacts your plan or about any other planning items, do follow up with us after this event. We're happy to see you, whether it's virtually or in person. We'd just love to see you. Have a great evening, and we hope to see you soon. Thanks so much. Have a great evening.